So first, I just wanted to talk to you just a little bit about sleeping position. Oftentimes after your shoulder procedure, you will be in an immobilizer for a certain amount of time as prescribed by your doctor. In this time, people typically find that it's uncomfortable to sleep. Oftentimes patients will opt to sleep in a recliner chair versus actually their bed so they can keep their arm in a little bit more neutral position and keep their head elevated. If you do decide to sleep in a bed, one of the things that you can try is propping yourself up with lots of pillows to keep your upper body more elevated. It's very important that you don't bring your arm in front of your body or back behind your body. The sling will prevent you from doing that, but positioning pillows behind the back side of your sling can be helpful. I'll also demonstrate one position that might be helpful if you do want to try to sleep on your side. So before laying down at night, one of the things I can do to position myself is with pillows. By taking the pillow, let's say that your physician allows you to be out of your sling, you can try taking that pillow and tucking it underneath your surgical arm. Note how I kept my arm in that very neutral alignment. Again, not in front of me, not behind me, but just kind of, again, right there at my side. So keeping my arm in that position, one of the things I can do is lay down on my non-surgical side. It's very important that when you start to sleep in bed at night that you do not sleep on the surgical side until your physician allows you to. So laying down in bed, what I can just do is come down on my elbow and then position myself just completely, like I said, on my non-surgical side. So laying on my side, I can do a couple of things. My arm is still in that very neutral position. I can try to make sure that, again, if you're a tumbler in bed at night, you can position pillows in front of you and behind you to make sure that you're not going to actually roll back and forth in bed. But usually what I say is that when you're comfortable, you'll usually stay in that position. But in this position, my arm is nice and relaxed and comfortable in a position that I'm not going to do any damage to my surgical repair. Hi, it's Kristen again. We're back, and today we're going to talk a little bit about some exercises that you can do after your shoulder surgery. I actually have Diana with me. She's going to help us demonstrate a couple of these exercises that we were referring to. So the first postoperative exercise is what's called the pendulum technique. Diana in this position can just slowly let her arm just hang at her side, of which she's going to move her body back and forth so that her arm sways, kind of like it's swaying in the wind. This exercise she can perform forward and back, side to side, and then circular counterclockwise and clockwise motions as well. Again, about 10 repetitions of each motion twice a day. Stiffness in the wrist and hand can develop after surgery as well, so she can practice just some squeezing of that ball that will come along with your sling. So again, just squeezing as tight as she can, holding for about a 5-second count, 10 times back and forth. And lastly, she can actually practice just pumping her wrists up and down, back and forth in the sling, again, to prevent some of that stiffness in her wrist and hand. Diana can practice bending and straightening her elbow. So in this position, she may or may not be able to do this on her own, so she can even assist with the other side if she feels like that is a little bit too painful or restricted. So there's a couple additional things that Diana can do to help prevent some stiffness, for example, in her neck, that she will get because she's been in her sling. One of these things is just kind of bending your chin towards her chest, going up and down, just kind of bringing her head back to a neutral position, back and forth 10 times, side to side 10 times, and even practicing turning her neck side to side 10 times. After these exercises, you might be a little sore. So doing some icing afterwards for about 20 minutes to the top of that shoulder is a really good idea to help prevent some pain and inflammation. The best way to apply or remove your sling is often just to sit at the edge of the bed or a chair with armrests with something underneath your shoulders to support your arm once you get your sling off. The first thing that you're going to want to do is just remove all of the straps around you. So you'll undo the seatbelt type strap around your waist, undo the 2 arm straps, and similarly all the Velcro. To actually come out of your sling, all you have to do is simply lean away from your sling. A caregiver standing behind you could potentially pull out the sling from behind you. Otherwise, you can lift your arm up and over, being careful not to use your shoulder musculature, and then you're out of your sling. Similarly, to get back in, just the reverse. So again, positioning the sling right by your side, slowly lifting your arm up and over. Again, being careful not to actually move your arm. Grabbing that arm strap first. I'm just using my right arm just to kind of help out a little bit with the straps. I'm not so coordinated with my one arm. And then strapping in the top strap as well. And then grabbing the seatbelt strap around my waist, strapping that back in as well. And then I can proceed to do all of the other Velcro straps around my shoulder, or around my forearm as well. There you have it, I'm back in my sling. After your shoulder procedure, there's a couple of things that you might find helpful. First, finding loose-fitting, big, baggy clothing, even with buttons in the front side, are easier to get in and out of. When you are dressing, it's always important to remember to dress your surgical side first, your involved side first. One method that can be helpful is what's called the gravity method, where I can just proceed to stand up and let my arm hang, putting my shirt through that surgical side first, and using my other arm to pull my shirt up and around and on. A perfect fit. When sponge bathing or showering, you can also use that anti-gravity method of letting your arm hang at your side to either apply deodorant or wash underneath your armpit. In any room, it's helpful to move objects from above shoulder height to low surfaces. Remember that you're not going to be able to reach up after your shoulder procedure. Installing handrails around your home to help you get in and out of bathtubs easier, to go up and down stairs easier, can be a safety tip. Remember that getting out of a low surface is always harder than getting out of a higher one. So thinking about where you're going to sit, practicing going from sitting to standing without the use of your arm can be helpful. If you need to, building up the height of chairs by putting extra blankets to increase that height of the chair so you have an easier time getting in and out as well. And lastly, removing clutter around your home. Get rid of those throw rugs, get rid of electric cords. Remember, maneuvering around your house might be a little bit more difficult. You might want to consider purchasing a few extra reusable ice packs that you can throw in your freezer. This can be helpful after your procedure to help with post-operative pain and swelling. Prepare some extra meals or purchase some extra frozen meals to throw in your freezer just to make cooking easier after your procedure. Similarly, remember that you're not going to be able to drive initially after your procedure, so setting up friends or family members to help you in your home, to help drive you to your post-operative appointments, such as your doctor's appointments and your therapy appointment, can be helpful, as well as arranging for someone to do your yard work, to do laundry, cooking, cleaning if need be. So hopefully you found these post-operative exercises helpful. Remember to do these things as advised. Doing them more isn't always necessarily better. If you do have any questions or concerns, feel free to always contact your physician or your therapist for follow-up questions. Thanks so much and have a great day.